The livelihood vulnerability assessment that we are going to kickstart with tomorrow, it's actually an exercise that we conduct annually, and we are mandated by the Disaster Risk Management Act number 10 of 2012, specifically section 13. It mandates us, together with the Namibia Vulnerability Assessment Committee, to conduct the livelihood and analysis in all the regions annually. So the main objective of the assessment is basically to provide accurate and timely information about prevailing food, nutrition, security in the country, and also other pertinent indicators on livelihood, to provide evidence-based and also to assist with policy formulation and immediate intervention that the government can provide to our citizens.
All right. Now, enumerators will be visiting selected households to conduct interviews in the 14 regions of the country. How are participants decided on, and who's really targeted for these interviews and also the assessments?
Okay. The assessment will be carried out by the officials from regional councils, and also of course officials from also the Prime Minister and also other line ministry. In fact, the NAMVAC committee is comprised of relevant ministries, NGOs, and also UN agencies here in Namibia. So, but the officials from regional councils will be conducting the assessment in their respective regions. So they spend 2 weeks of training in Oshiwarongo, and they are really ready for the task. The household, how they were selected, basically we used a random sampling from Namibia Statistic Agency. So it's a random sampling method that we are going to use, and we should also highlight here to the public that this is not a census, so we are not going to count every household. So households are identified randomly, and they will be visited by enumerators.
Now, considering the amount of objection to questions asked during the census process back then, what type of information should participants then expect to be asked about this time around? Okay,
very good. Our survey is basically around livelihood. For instance, questions will be around food availability, both crop production and also livestock production, market access to food, for instance, issue of transport, and also food reserve. How much do you have, for instance, and also around import. Are we importing maybe from other countries and so forth? We will also look at food access, both physical and also financial, food utilization, food preference. Some people prefer types of food, food preparation, how food is prepared, feeding practices, how many times maybe a household is getting a meal and so forth, and also food storage, how are we storing our food. We are also looking at indicators that are looking at water security, how our people are getting water, for instance. Are they getting it from boreholes? Are they getting it from private taps? Are they getting it from public taps? Are they getting it from river, natural spring and fountain, and so forth? And then we are also looking at the issue of sanitation, of course. Does our people maybe have, flushing toilet in their household, bucket toilets, defecation, open defecation? So the questions will really come around those indicators. And then we are also going to look at issue of vulnerabilities. We know we are going through difficult times, different types of hazards that our people are going through. So the question will also come around those areas. Food consumption, both quantity and quality, and also nutrition, the value of nutrition in those food that our household are consuming. And also food security indicators such as food consumption score, which measures different types of groups of food that the household is consuming per week. And we are also going to look at issue of nutrition and status. Mortalities for children under 5 years old. So we are working very, very closely with the Ministry of Health. They are going to take measurement for the mark to determine the malnutrition rate in our country. We are also going to look at the content of, for instance, mineral, vitamins, iron, iodine in the food that our people are consuming.